On this episode of the podcast, I have with me John O'Toole. He's the Senior Director of Data Analytics at Tendo. We're going to be talking about improving and impacting the patient journey. Tendo's got a lot of data they work with, and we're going to understand how data is being used to improve that patient care. We're going to also talk about, once we have the data and we have all the, metrics and analytics that we can provide, how do the offices and the people in the field actually change and adopt workflow? Because that's actually a big impact to a lot of this. And John's going to walk us through as much as we can. And John, I appreciate your time and thanks for being on the show.
Thank you for having me. It's great.
So before we start, obviously sounds like you guys are in healthcare, talking about patient journey, but specifically, let us know what Tendo does so everyone's aware.
Yeah, so Tendo is a software-first company. We offer a patient care journey app. We also do what is called insights. And so we help essentially hospital providers find opportunities on how they can improve their rankings. So, most people are, familiar with U.S. News and World Report. So we look at those national rankings and we're able to point those hospitals in the direction of if you, improved here, this is how you could improve those rankings, as well as CMS, things like that, so that we can help providers improve on their penalties and things like that with reimbursement through CMS. Other than that, we're starting to get into the provider portal as well. So not just having the patient portal, but being able to have the providers work with their patients through that and focus on how can we improve that patient care.
Awesome. So when we talk about, obviously we're going to be talking about improving, impacting the patient journey within healthcare. We hear a lot about data driving. There's always data driving something. When we're talking about data driving or improving patient care, as a practitioner, tell us, what does that actually mean?
Yeah, so I think it's, guiding providers, not just giving them data and dashboards per se that they have to try to go and find, we'll say these insights themselves, but providing them actionable data, right? So this is this patient, this is what happened to them and what was missed in the, we'll say, human parts of healthcare, and this is what they need. So what we do is we're able to look through their, electronic medical record, find those areas where things have been missed, push them to the provider to say, this is what we found. Do you agree? And then have the provider basically check a box that says yes. And then through our patient care journey app, we're able to outreach those patients and say, we found this in your past medical history. It's important that you follow up with your provider and make an appointment. We've recently taken on a company called MD Save. And what that is, it's essentially a bundling service where patients can shop through our patient portal for services and pay a flat fee. So if you want like a knee replacement, you can go on there, find a flat fee for a knee replacement. You don't have to worry about your insurance, or if you don't have insurance, you know exactly how much you're going to pay for something, which I think is just another huge patient service these days of, even me as a patient, I've worked throughout my career on the business side as well, where I've worked in finance, and it's all funny money. And one of the biggest frustrations is I have no idea when I go to a provider how much I'm going to have to pay. And so that's just something that was like a recent acquirement that I think is going to be really powerful and helpful to patients as well.
Interesting. The one thing I always, when I think about the healthcare industry, I think about how much data, all the touch points of data that gets collected. And I guess, we and then instruments, right? I mean, we have instruments that are collecting people, doctors' notes, and, they actually not only test, but the notes as well. There's a lot of data. When you guys, as a company are looking at what to tackle, right? What looks like it should be the, highest value you can provide if you're working with particular data set. How do you guys evaluate one data set or the other? Because it seems like almost all of it can be really strongly fashioned to be very valuable to patient care.
Totally. I think so what we do is we start at the top, right? So the top, when you're looking at, and it varies depending on like inpatient and outpatient data, right? So inpatient data generally is bucketed in, it's all based on, the administrative data is easiest to go after. That's based on how people get reimbursed, because standard across the nation, everybody has to report to these insurance companies to primarily follow CMS, Center for Medicaid and Medicare Services. And so they all have to report DRGs, which are diagnostic related groups. So for inpatient. So we look at diagnostic related groups, and then we look at a variation within the hospital itself. And we're able to see, it could be based on provider or area or cost, right? Like, where's the highest cost? Where's the highest length of stay? Where's the highest mortality? We look at those quality measures, and you're able to see that. And then we also were able to kind of benchmark across the nation. So using CMS data, right? We download this national data. We're able to see, how do you compare versus other hospitals? And so when we look at that and we're able to compare against, peers and within your internal kind of benchmarks, that's how we identify some of the major places to go. And then it gets into the business side. So it's important to talk to like the chief medical office a lot of the time. So we talk with the CMO, and then you're able to find, well, this is explainable because of XYZ, or, oh, this is a great opportunity because there's a new chief of that department, and they're really looking for these kinds of opportunities to make changes. Or, this has a lot of new physicians, and maybe they're, younger physicians out of med school, something like that. So by partnering with the providers, you're able to figure out exactly where to go.
I was actually thinking, as you were kind of explaining how you guys are evaluating some of that, high priority target analytics and data, products that you can deliver. I was thinking that the amount of different types of medical care and providers there are, and understanding, those different needs, and understanding, how you can actually fashion the data to be applicable. Are you looking down to that level, or is this more about making sure that, groups of doctors are, meeting certain benchmarks and getting, the best, data results that they can to help improve the patient journey?
It's a journey itself, I would say, right? So we start at the top to find those, low hanging fruit, you'll call it, right? And that's where we start with the CMOs, where it's like, they're able to, we give them top 20% of variation, right? That we find in those high level things of like length of stay, things like that. But then once we start getting into the project, it goes very detailed. So we start to look at, and again, administrative data is the easiest because it's all standardized, and like charges, right? So we can look at what kind of supplies are, you're using on a surgical case, and what kind of pharmaceuticals. So there's a project that we did in the past where like just giving a patient ice chips is as effective as this medicine that would actually cause a longer length of stay because they had to be on it. So, there's these like very, you could get very innovative by just getting into that, like we call it charge level detail. But then there's also, this project that we're doing with looking through the patient chart for EKGs and outreach. So this is a project through Cardiology at Rush, which is a foundational customer of ours. We have a very close-knit partnership with them. And so we look through their tests for all EKGs to find opportunities. So when we find something like either in the node interpretation where the radiologist said, severe valvular disease. Or we also look through the measurements provided by the test. So it might be that, their aortic valve was higher than, X measurement, to see if there was something missed in the interpretation. And so by doing that, we're able to flag when a patient, we look to see if they were not followed up on after that, like if they've had an appointment with a valvular specialist, or if they've had a procedure done. And if they haven't, that's when we're able to flag them as something was missed. Again, like either it was maybe the patient, themselves didn't follow up. Maybe it was that somebody didn't see that the test result was severe. Maybe it was that the radiologist didn't see the right measurements. Just trying to make up for that human error. And, people try to say that AI is, going to replace everybody. What I like to think of it as is, AI will miss, 20% of things. Humans will miss 20% of things, but together we can maybe make it that we miss only 5% or 0. So
I like that. You've referenced the chief medical officer, and obviously we're talking about people in the field, people in offices, people that have workflows that might have, they're in the business, they're in the industry, they spend a lot of time. People typically don't leave the medical industry once they're in it. Like it seems like they'll find out. So when you're looking at that workflow, and you guys are obviously providing these metrics, analytics, adoption has to be key. I don't know if you run into the scenario where people are like, I've been doing it this way for a long time. I could imagine some doctors that I've seen would maybe start with that. I've been doing this for a long time. Maybe just give us a little bit of insight in terms of that partnership and adoption, because it's got to be an interesting conversation.
Oh yeah, that's a great insight. And the other line is our patients are different.
Yeah, of course.
Everybody believes that their patients are, very unique, and that's why they're an outlier in the data, right? And so that's when it's key. Like you had mentioned getting into the detail of, this is what the data shows, right? Like they're not different, or maybe they are different, but nationally, you're still gonna this data is published now nationally, right? There's doctorscompare.gov, and that's what it really gets to them, So essentially, what we have to do with providers is we have to kind of get at their competitiveness a lot of times. And so whether it's comparing them to other providers within the departments at their facility or across the nation, that's what tends to, gauge a little bit of their ability to participate in the process. But, gauging that, I guess what you'll say is like desire to participate and champion it is really key. So, when we go to providers, it's not like just saying, hey, we can give you this stuff and it's going to solve all your problems, right? We can give you all this stuff, but you as, a senior leader, and it doesn't have to be the chief medical officer, but someone who, is going to make the charge of working with these physicians, whether it's a carrot or a stick, if you will, it is really key. So I've been working in the business for, close to 15 years now. And so the first half of that was on the business side. So that's a lot of what I'm, able to appreciate is how do you work with the physicians? And, my first job was switching a clinic from paper medical records to electronic medical records. And these physicians were like, no, I'm not going to do it. Like, I'll just retire, or, and so it's just really having to figure out how are you able to work with them? And, but yeah, that's what's key with data is getting that partnership with the providers. If you don't have that, then data doesn't do anything, right? You can put the thing in front of somebody's face all day, but if it's not actionable and you can't make it as easy as possible for providers when they're already, I say this stuff, but providers are really busy, just like everybody else, cost cutting and reimbursement cutting, like more and more is put on them. That's why we also talk about giving them the ability to practice at top of license, is what we call it. So, their job should be focused on what they went to medical school for, 15 years of their life, right? Being able to see patients and take care of them. And so by enabling these outreach campaigns where we're searching through their medical records and providing insights on, hey, this patient needs to be seen, and putting it right in front of their face so that they don't have to spend the time searching through medical records to be able to just hit the OK button and reach out to them. It's key to just essentially ensuring that we're there to make their lives easier, not attack them or like just say, what they could have done better is really key in that engagement as well.
You mentioned AI. I know the episode's not about AI, but as we were talking about the providers and we're talking about workflow, we're talking about adoption. I guess as we go forward and see more AI being introduced, whether it's Gen AI or whatever the flavor of AI that's being used, computer vision, deep learning, all this stuff that we're hearing out there. As you start seeing more of that coming to market, in terms of like when we're looking at the healthcare industry, there's a lot of data. There's a lot of areas where we're going to see these connections and identify things that humans can't because we can't see across all the data points. When you're thinking about adoption in the future as the more advanced technologies start being introduced and you start seeing medical providers, like you said, rather retire, software engineers like Copilot type products like GitHub Copilot, they're like, this is great. Like if I don't have to go Google and it knows it already. Do you anticipate, and I know this is way out there futuristic, but do you anticipate the medical community starting to realize that it's more of a co-pilot than a replacement? Is that maybe a nuanced difference that we might be seeing down the road?
Yeah, I mean, I think that's the only way it will succeed. It's not that computers take it over the world. It's that it's a partnership. I do see a lot of, if folks start thinking of it as this can make patients' lives better and my life easier, I think that that's the way that we're going to succeed. Like if we can do a little bit of the, less resistance. There's, people say, well, you can't replace a surgeon. Yep. It's like, there's robotics, there's robotic surgery right now that, it's like, oh, you can't replace an umpire or something back in the day. Yeah. Well, I don't know. Based on some of the games that have been going on recently, like, well, yeah, you can. And so I don't think it's ever going to be a replacement, but I do think that if providers get on board and see, like what we're talking about here, where it's enabling them to make their patients' lives better by partnering with it and just seeing like, this was a miss. People do typos in emails all day, right? Like physicians are human. Mistakes happen. And there's going to be things that, those nuances that the human eye sees that AI doesn't. I think that we're all going to be in a better place for it. But way in the future, it'll be interesting to see. It'll be after I'm no longer here. But I would really love to see where all of this goes at one point in life.
It's interesting. I agree with everything you said, and a lot of times when I run into people, they're like, "Oh, AI this, AI that." I actually just, if they're, let's say, they're an iPhone user, I go, "Hey, when you get in your car and CarPlay kicks in and goes, the map pops up and says you're going this direction. All you have to hit go and just follow the directions there. Do you like that? Oh yeah, it makes it so much easier." I go, "Oh well, welcome to AI. It just is. That's what it did." Didn't replace somebody's job. No, it replaced 2 minutes of your time looking up the address. And I go, it just knows that at 9 o'clock you're heading towards the doctor's office. Here you go. So I find it very interesting because it's so interweaved in our lives currently, and on a consumer basis,
100%.
hasn't hit people at work yet to realize that it might actually make you more productive. You might see more patients. And I think that's really when we talk about healthcare and what you just mentioned, I'm like, how great would it be if a doctor could see a couple more patients and actually have better value and better patient care because they're not worried about thinking through all the things that a machine's helping them with.
100%. Yeah. And to that other point of it's already in our lives and people are, afraid of it. And I think that, Congress does have a job to do. Like they have not, we need better laws protecting a lot of the things having to do with AI and privacy and things. And they just, but the way it is today, it's like people worry about getting injected with trackers. It's like, what are you carrying around with you all day? Like that phone, right? Like,
yeah, exactly.
Google Maps, right? It's all there.
Yeah.
People just are maybe in denial of it. And so that's where I'm like, at least, if we're not going to have the laws to protect us, just, embrace it for right now. See how it goes. But
I love it. I joke with my buddies. They're all like, I don't have an Alexa in my house. I go, listen, at this point in my life, I want every device to know when I want a pizza at 6 o'clock on a Wednesday, because I mentioned it just have the pizza show up at my door with the toppings, the way I like it cooked and cut. Just have it show up. Charge me already, and I got dinner done. So if we can get there, I'd be a happy man. And I think, like you said, embrace it if you can't resist it. So in this case, it's here. We're going to deal with it.
Yeah, and that is the next. Those are like future steps for our patient journey app too. So like ordering a lift for you if you need it, right? And getting you to the provider as easy as possible. And yeah, it's really exciting to see, there's these other patient portals out there that have limited functionality and they're very siloed. And so what we're able to do is just build on top of those. So we're not trying to replace, the major vendors that are like your electronic medical record ones, right? We're just trying to fill the gaps and pull it all together. So, part of, the gap in the medical field in the US is it's both a protection and a hindrance of just the privacy of data, right? Like it's really hard to share that data and everybody creates the data differently. So the really nice thing at Tendo is we're able to, standardize that data across our different clients to be able to show, like I said, variances before, but also just is able to standardize that data and make it so that we can bring all of your patient information into one place. So you don't have to go to a million different portals and log into all these places, but also, like I said, fill in some of the gaps that those major vendors either aren't able to do or just haven't gotten to yet. So hopefully, like you said, we'll get them a pizza like on their way to the like waiting for them in their lift as they go to their provider next time. We'll see how it goes.
There you go. The life goals. John, thanks for being on. Thanks for sharing. You got a fantastic background with data and deep into healthcare. If somebody wants to reach out to you, tap into either something you've mentioned or just something, within the industry or within data, is there a good way of connecting with you?
Yeah, john@tendo.com.
All right.
That'd be great.
That's an easy one. We'll make sure we include some of your contact in the show notes. Thanks again. Thanks for coming on. Thanks for sharing. I appreciate it.
Yeah, I appreciate it too. It's always nice to talk to another data geek and pontificate over the future too a little bit.
Absolutely. That's it for the episode. Be back again, different guest, different topic. Until then, two things. One, a great episode talking about healthcare and what data is going to be doing, some near term, some futuristic stuff in the discussion. Share with somebody else who might be interested. I think healthcare's got a lot of data. We're going to see a lot of awesome stuff come out from the space. So please share the episode. Also, like, subscribe, leave a comment, leave a review. Let me know how we're doing. Always like that feedback. Until next time, thank you and goodbye.